morning, we've been talking about MND after Hollywood star Sandra Bullock's partner died from the condition, motor neurone disease. Brian Randall, who was a photographer, died at the age of 57, 3 years following his diagnosis. It's the most common type of motor neurone disease, the type that he had, ALS. And motor neurone disease affects the brain and parts of the nervous system, leading to muscle weakness and difficulties talking and swallowing. In Jersey, around a dozen people are known to have the condition. They're supported by a specialist nurse and a local charity. But after the state's cut funding for the nurse, the MND Association for Jersey has been paying for it. That's due to stop in October. The charity is in discussions with the government about funding the vital post. Let's speak now to Deputy Malcolm Ferry, who's the Assistant Minister for Health and Social Services. Good morning to you, Deputy.
Morning, Jenny. How are you?
Yes, I'm fine. Thank you for your company this morning. Can you please tell us, Deputy, why funding was actually taken away in the first place?
Yeah, so just to bring you up to date on this, Jenny, the Minister and I met with the Director of the Motor Neurone Disease Association earlier this year, and the post is currently funded via the Medical Care Group, and he explained, the value of the service, the 17 patients that they offer through an outreach service that supports people in the community. Obviously, that's a lifeline to people who have this disease. So, we're currently in discussions still with the charity, and we plan to meet them again in September. But to look at, the resource requirements for the continuation of the service. So we need to understand a bit more. We need to make sure where the service is going. But they submitted, a very well-written funding request, and I've been through that. I've read the whole thing. I'm positive about it, but where we are at the moment, of course, is the government plan process for this year is still underway, and that we're still lodging funding proposals right the way up through until September. So that's where we are at the moment, Jenny.
So when the charity has to stop funding in October, is it likely that Jersey's government will step in?
I'm certainly hoping so. I mean, let's not forget that, the neurology department is still available to support patients with this terrible disease, but obviously not in the same way as receiving an outreach service. So, we understand the value of care in the community. I myself have worked for a brain injury charity, and I know the value of that lifeline to patients. So I'm really positive that we will be able to find a future for the charity. It's just actually buttoning down at this moment in time. Obviously, I can't do that until we've been through the full process, Jenny.
Might it be that this funding was taken away and a charity's had to step in, and we're not sure whether there'll be funding again in October when the charity has to stop, because it's a small number of people in Jersey who have MND?
Well, having worked in a charity myself, I know that, surety of funding is a big part of the comfort for not only the person who's doing the job, but part of comfort for the patients to know that they're going to continue to receive that level of service. It's in a situation that obviously none of us want to be in, but these things take time. And of course, the government plan is over a number of years, so it's not as if money can just appear at fairly short notice. So this is why we're continuing the discussions and we're looking for a way forward, Jenny.
I spoke to a couple yesterday, and you may have heard them this morning on the programme, Deputy, who live with MND. And they said, well, the government's wasted all this money on a hospital that's not been built, yet we're asking for one post to be paid for. What would you say to that?
Yeah, it's very difficult to draw comparisons with, a whole health service and a small charity which is doing great work and helping a small amount of people to live fulfilling lives. Those sort of comparisons, I can understand in the public mind, that's the way they're viewed, but I like to focus on what we can do to help the people in this particular charity going forwards, rather than, comparing two different scenarios, really, Jenny.
It is about money, though, at the end of the day. How much money would it cost to fund this post?
So this post requires £50,000 per annum, which, again, lots of people would say that that's not a huge amount of money. But don't forget, we're at a time when the health service itself, health and social services, is having to look seriously at its funding, because it's basically overspent for this year, and we need to look at everything and anything which is going out in terms of money from the service.
I mean, I can't help but take us back to the finances there. We are talking about money here. We're talking about a post possibly stopping because there's not the money. And now we're talking about £50,000. And this is for a specialist to do their job, for people who rely on her for their daily well-being. The couple I spoke to yesterday said they would like politicians to spend a day with them, to realise just how much specialist care they need to lead a life that they're content enough with. Would you be willing to do that? Are you understanding the situation here? £50,000 in the grand scheme of things, and we could bring the hospital up again, is nothing, surely.
I completely understand the challenges that people with this disease face. As I said earlier, I worked in a charity that supports people with brain injury, which I know isn't motor neurone disease, but a lot of the symptoms are very similar. So, I do completely understand the value of what this charity is doing. I do completely understand the challenges that people are facing who have got brain conditions, and I'm doing everything I can to try and get to a satisfactory endpoint for this story. That's all I can really say at the moment, Jenny.
What would be a good reason to not do this, to not be able to cough up £50,000 for one nurse caring for over 10 people with complex needs?
Well, exactly. But it is a question of us having to look at finances all across the board. So it has to be a level playing field. It has to be equitable for everybody. We just haven't arrived at that final outcome yet. And
when might you, please, Deputy?
Yeah, so we are meeting again with the director of the charity in September of this year, and we're hoping to explore further options at that date.
And finally, I've got to ask you, a charity in Jersey has been relied on, the MND Association for Jersey. Do you have anything to say to the charity after the government stopped the funding and the charity took over? Should we be relying on charities to fund health posts like this?
There's always a balance. As a government, we recognise the value of the charitable sector to the community. We also understand that some charities self-fund, some charities fundraise, some charities rely on some government support. It's getting that balance right. It's making sure that we're getting value for money. It's making sure that patients are being supported in a safe as possible way. So all of these things need to be taken into consideration. And that's not pointing anything at any one particular charity. That's what we need to be doing across the board, Jenny.
Deputy Malcolm Ferry, the Assistant Minister for Health and Social